So this course is called Measuring Health System Performance, and it's a course where we review the state of the art around performance measurement of healthcare systems, healthcare providers, and even individual physicians. So within this course, what we'll be doing is reviewing the different types of indicators that are used to measure different aspects of performance. So for example, we'll look at the indicators that are used to evaluate things like quality, efficiency, equity of healthcare systems, but also thinking about the safety of particular hospitals or the value for money around particular programs. We'll also look at the methodology that you need to appreciate in terms of the construction of indicators. So for example, when I look at a summary measure, what should I take into account when evaluating it to really understand what it reflects? Or if we're looking at a particular indicator, how do I know that it's been adjusted for the right factors and truly reflects what I think it's measuring? Finally, we'll look at performance programs that make use of these indicators to try to understand when can we attach financial incentives or publicly report different indicators. What are the implications of doing so? Are we confident in the validity of the underlying indicator when we use these in incentive type programs? And finally, do these programs work? What does the evidence say about how well they've worked across different systems or within different hospitals? You can expect to walk away from this course with a good understanding of the state of the art of performance indicators across a range of performance domains. Things like how do you measure the health of a population, the quality of care of a hospital, or even the efficiency of the entire healthcare system. This can be really useful for professionals in different roles. For example, policymakers who need to make decisions about how to appraise the performance of their healthcare system. For providers who are often assessed and increasingly assessed by a number of these different measures. Or even managers who are looking to implement incentive programs that attach real incentives to different types of performance indicators. By truly understanding what these indicators measure, what you need to be cautious of in terms of their construction and application, you can come away with a good understanding of how to make the best use of these indicators in whatever setting you're working in. I'd say the most interesting and exciting aspect of the course is also the funnest part of the course, which is a workshop that we do towards the end of the week. In this, students come together in different groups that they've been assigned to, where they're chosen to represent a particular country. We give each group a lot of information about the country, together with a fictitious report card assessing the performance of these different countries. We ask students to evaluate a range of questions around these indicators. So for example, is it appropriate to use these indicators to evaluate the performance of the health system? Can we compare different health systems with these indicators? Is their construction sound? Can we combine them into a summary measure? Can we attach incentives to them to improve the performance of any one system? Students come together in this one day to debate these questions from the perspective of their own country. This is a great real-world application, but also a very fun exercise and a great way to end the course and really showcase the real-world application of all of the material that we'll be covering. I think it's very easy to see the real-world application of this course because the material is so applied. So for example, if you're a policymaker, you can walk away from this course with a really good appreciation of what are the indicators that are currently available for you to assess the performance of any one particular healthcare system, or in fact to compare that healthcare system to another. As a provider, you can walk away with a good understanding of what are the metrics that are used to assess your own performance. How do policymakers adjust for confounding factors, and do you think that that's a fair adjustment? What are the methodologies around that adjustment that you need to be familiar with in order to make those decisions? So depending on who you are and what stakeholder you're interested in, there's a lot of applications here that really relate to the real-world use of performance indicators. So this course can enhance your career options by giving you a really good understanding of everything you need to know around the performance indicators that you come across on a daily basis. So for example, if you're a policymaker, you're probably inundated with a number of different performance indicators. After completing this course, you can come away with a good understanding of which one of those are the state of the art. If I'm using a particular indicator, what do I need to be careful of? What aspects of performance can it really measure well, and which aspects might it not be so great at covering? If you're a provider, you really come away with a good understanding of what are the measures that managers might use to incentivize your performance or even publicly report your performance, and really appreciate all of the factors that might influence those indicators, as well as the methods that are available to adjust for those factors.